You're tuning in to EM Spanish. Today we'll be going over trauma, part 1, also known as bang bang, bang bang bang, explosions. I'm your host, Professor Sancho. Again, the views and opinions expressed in these podcasts are mine and mine alone. Always use licensed interpreters when caring for your patients, and we cannot be held accountable for any consequences or make any warranties over the accuracy of these lessons. Today we'll be going over the primary survey, as well as some quick anatomy and different ways to describe wounds you'll come across. Additionally, we'll go over the physical exam to assess a patient's mental status, as well as their musculoskeletal abilities. In part 2 of this series, we'll continue the secondary survey, as well as go over specific vocabulary for different scenarios, such as chief complaints you may come across. When a patient comes in, you can tell them, don't move your head for anything. No se mueva su cabeza para nada. Don't move your head for anything. No se mueva su cabeza para nada. There was an accident. Hubo un accidente. There was an accident. Hubo un accidente. We're here to help you. Estamos aquí para ayudarle. We're here to help you. Estamos aquí para ayudarle. Let us move you. Permítanos moverle a usted. Let us move you. Permítanos moverle a usted. Don't move, please. Por favor, no se mueva. Don't move, please. Por favor, no se mueva. Then for the exposure part of your ABCDE, we need to remove your clothes to check for injuries. Tenemos que remover su ropa para revisarle para heridas. We need to remove your clothes to check you for injuries. Tenemos que remover su ropa para revisarle para heridas. Breathe more slowly. Respire más despacio. Respire más despacio. Okay, we'll just do it. We need to remove your clothes to check for injuries. Tenemos que remover su ropa para revisarle para heridas. We need to remove your clothes to check for injuries. Tenemos que remover su ropa para revisarle para heridas. Breathe more slowly. Respire más despacio. Breathe more slowly. Respire más despacio. Let us move you. Permítanos moverle a usted. Let us move you. Permítanos moverle a usted. Don't move, please. Por favor, no se mueva. Don't move, please. Por favor, no se mueva. We need to remove your clothes. Tenemos que remover su ropa. We need to remove your clothes. Tenemos que remover su ropa. To check for injuries. Para revisarle para heridas. To check for injuries. Para revisarle para heridas. Breathe more slowly. Respire más despacio. Breathe more slowly. Respire más despacio. How many fingers? ¿Cuántos dedos? How many fingers? ¿Cuántos dedos? Can you see this light? ¿Puede ver esta luz? Can you see this light? ¿Puede ver esta luz? Look straight at the light. Mira directo a la luz. Look straight at the light. Mira directo a la luz. Follow my finger only with your eyes. Sigue mi dedo solo con sus ojos. Follow my finger only with your eyes. Sigue mi dedo solo con sus ojos. Does it hurt when I press here? ¿Le duele cuando le aprieto aquí? Does it hurt when I press here? ¿Le duele cuando le aprieto aquí? Where does it hurt the most? ¿Dónde le duele más? Where does it hurt the most? ¿Dónde le duele más? Does it hurt anywhere else? ¿Le duele en algún otro lugar? Does it hurt anywhere else? ¿Le duele en algún otro lugar? Does it hurt more? ¿Le duele más? Does it hurt more? ¿Le duele más? Tell me if it hurts. Dígame si le duele. Tell me if it hurts. Dígame si le duele. Does it hurt less? ¿Le duele menos? Does it hurt less? ¿Le duele menos? Touch the spot. Tóquese el lugar. Touch the spot. Tóquese el lugar. And very briefly, we're going to go over some general, very basic anatomy. So skin, piel. Not peel, but piel. So skin, piel. Head, cabeza. Head, cabeza. Neck, cuello. Neck, cuello. Back, espalda. Back, espalda. Arm, brazo. Arm, brazo. Hand, mano. Hand, mano. Fingers, dedos. Fingers, dedos. Chest, pecho. Chest, pecho. Abdomen, abdomen. Abdomen, abdomen. Hip, cadera. Hip, cadera. Pelvis, ingle. Pelvis, ingle. Buttocks, nalgas. Buttocks, nalgas. Penis, pene. Penis, pene. Vagina, vagina. Vagina, vagina. Knee, rodilla. Knee, rodilla. Leg, pierna. Leg, pierna. Foot, pie. Foot, pie. Toes, dedos de pie. Toes, dedos de pie. Or literally, fingers of foot. To describe different wounds. For a cut, corte. A cut, corte. A wound, herida. A wound, herida. Swelling, hinchazón. Swelling, hinchazón. Fracture, fractura, fracture, fractura, burn, quemadura, burn, quemadura, blow, golpe, blow, golpe, dazed, aturdido, dazed, aturdido, twisted, torcido, twisted, torcido, bleed, sangrado, bleed, sangrado. Are you bleeding? Está sangrando. Are you bleeding? Está sangrando. To refer to a right side, derecha. Right side, derecha. Left side, izquierda. Left side, izquierda. Up, arriba. Up, arriba. Down, abajo. Down, abajo. Superior, superior. Superior, superior. Inferior, inferior. Inferior, inferior. Orientation to person, place, and time. Tell me your name. Dígame su nombre. Tell me your name. Dígame su nombre. Do you know where you are? ¿Sabe dónde está usted? Do you know where you are? ¿Sabe dónde está usted? Do you know what year it is? ¿Sabe qué año es? Do you know what year it is? ¿Sabe qué año es? Do you know what month it is? ¿Sabe qué mes estamos? Do you know what month it is? ¿Sabe qué mes estamos? Open your eyes. Abra los ojos. Open your eyes. Abra los ojos. Squeeze my hand. Apriete mi mano. Squeeze my hand. Apriete mi mano. Move your toes. Mueva los dedos de pie. Move your toes. Mueva los dedos de pie. Can you feel me touching you here? ¿Puede sentir cuando le toco aquí? Can you feel me touching you here? ¿Puede sentir cuando le toco aquí? Do you feel 2 points or 1? ¿Siente un punto o dos? Do you feel 2 points or 1? ¿Siente un punto o dos? Did you lose consciousness? ¿Perdió la conciencia? Did you lose consciousness? ¿Perdió la conciencia? Before, antes de. Before, antes de. Chest pain, dolor de pecho. Chest pain, dolor de pecho. Difficulty breathing, dificultad al respirar. Difficulty breathing, dificultad al respirar. Did you faint? Se desmayó. Did you faint? Se desmayó. Were you taking alcohol? Tomaba alcohol. Were you taking alcohol? Tomaba alcohol. Do you have a pacemaker? Tiene un marcapasos. Do you have a pacemaker? Tiene un marcapasos. Are you on meds for hypertension? Toma medicamentos para la alta presión. Are you on meds for hypertension? Toma medicamentos para la alta presión. Bleeding disorder. Enfermedad hemorrágica. Bleeding disorder. Enfermedad hemorrágica. Taking anticoagulants. Toma anticoagulantes. Do you take anticoagulants? Toma anticoagulantes. Seizure. Ataque. Seizure. Ataque, or literal attack. Additionally, one can describe a convulsion, which would be convulsion. Convulsion. Spasm. Espasmo. Spasm. Espasmo. How long were you unconscious? ¿Cuánto tiempo estuvo inconsciente? How long were you unconscious? ¿Cuánto tiempo estuvo inconsciente? Were you walking after the accident? ¿Caminaba después del accidente? Were you walking after the accident? Caminaba después del accidente. Now for various commands to use during your musculoskeletal exam. Push. Empuje. Push. Empuje. Pull. Tire. Pull. Tire. Squeeze. Apriete. Squeeze. Apriete. Open. Abra. Open. Abra. Close. Cierre. Close. Cierre. Raise. Eleve. Raise. Eleve. Lower. Baje. Lower. Baje. To ask a patient to cover their left or right eye respectively. Cubra el ojo izquierdo or derecho. To ask a patient to cover their left or right eye respectively. Cubra el ojo izquierdo derecho. Read the figures on this card. Lea las figuras sobre la carta. Read the figures on this card. Lea las figuras sobre la carta. And that's it for part 1 of trauma. In the second part, we'll cover the remainder of the secondary survey, since we've already gone over neurological as well as musculoskeletal. Then we'll go on to cover various chief complaints that you can find in a trauma setting, and then give you some parting words for your patients. So we'll see you in episode 2. Click like and subscribe if you find this helpful, and thank you for tuning in.